Is your penis shrinking with age, or is it just your imagination? You're not the only one asking that. I hear this all the time in my office. Often whispered, sometimes joked about, but always with a real concern behind it. Hi, I'm Dr. Max, urologist, men's health expert, and the guy who talks about all the stuff you've been too embarrassed to Google. Today we're talking about a question that's more common and more misunderstood than you might think. Does your penis actually shrink as you get older? Let's get one thing straight. A lot of what you think you know about penis size comes from locker room talk, late-night internet myths, or comparison traps that never made anyone feel better. And here's the kicker: most men who worry about being too small are actually within the normal range. But once that thought is planted, it eats away at your confidence, your performance, even your relationships. So today, we're going to look at the facts, real data, not fantasy. We'll talk about how penis size changes over time, what's actually normal, what's not, and when it's a sign of something more serious. Spoiler alert, for most men, your size hasn't really changed, but something else has. We'll get into that in a second. For most men between 18 and 30, the average erect penis size is around 13 to 15 centimeters. That's roughly 5 to 6 inches. Now, does that mean everyone fits into that range? Of course not. There's a natural variation, just like height, shoe size, or voice. But yes, most men are right there in the middle. Now, what happens next? Between the ages of 30 and 50, the actual size of the penis usually doesn't change much, anatomically speaking. But here's the twist: a lot of men start to think it's getting smaller. And no, you're not imagining things. That's perception, not actual shrinkage. And that perception often comes from changes in your body, your hormones, or your confidence, not from the tissue itself. But once you get into your 50s and beyond, things can shift a bit. We're talking about visual shortening, not actual loss of tissue, but changes that make the penis appear shorter. The most common culprit? The fat pad, that soft tissue just above the penis. As we age, and especially if we gain weight, that fat pad grows. And as it thickens, it starts to cover the base of the shaft. So it's actually still there, just gets hidden. It's like sinking into a soft couch. The structure hasn't changed. It's just more buried than before. And here's a quick line I always tell my patients, because it usually gets a smile and a sigh of relief. It's not the penis that shrinks, it's the area around it that changes. And that's great news, because it means we can do something about it. So, if your penis isn't actually shrinking, why do so many men feel like it is? Let's break it down. There are a few key factors, and none of them are about you losing your manhood. But they do affect how you see and experience your body. First, testosterone. As you age, your testosterone levels naturally decline. That's part of being human. But testosterone affects everything, not just your desire, but also the firmness, fullness, and frequency of erections. So even if your size hasn't changed, your erections might feel softer or less frequent, and that tricks your brain into thinking something's shrinking. Second, the fat pad. Remember that area just above the penis? It's called the pubic fat pad. As we gain weight, especially visceral fat, that pad thickens and starts to bury the base of the shaft. So, what was once visible, now isn't. The penis is still the same length, but it looks shorter. And that can mess with your self-image fast. Third, blood flow. A strong erection depends on strong circulation. When blood flow drops, and that happens with age, lack of exercise, poor diet, the penis just doesn't fill the same way. Think of it like water pressure. The pipes are there, but the flow is weaker. And here's another factor that doesn't get talked about enough: Peyronie's disease. It's a condition where scar tissue builds up inside the penis. That leads to curvature, sometimes pain, and yes, visual shortening. It's more common after 50 and often goes undiagnosed for years because guys are too embarrassed to ask. Quick reality check: stress, diabetes, and smoking. They all reduce blood flow too. And when blood doesn't move freely, nothing works the way it should. Not your erections, not your confidence, not your energy. Bottom line, it's not that the penis is shrinking, it's that the conditions around it are changing. And thankfully, most of those conditions can be improved. Now, let's talk about something important. When should you actually be concerned about changes in size or function? Because yes, some changes do need medical attention. First, sudden loss of size. If your penis looks noticeably shorter over just a few weeks or months, that's not age, that's a red flag. This could point to tissue damage, scarring, trauma, or even reduced blood supply. Don't ignore it. The earlier you act, the better the outcome. Second, curved or painful erections. If you notice your erections bending to one side or feel discomfort during arousal, this could be Peyronie's disease. It happens when scar tissue builds up inside the penis. It can cause shortening, discomfort, and affect your sex life. But the good news is, we can treat it. And no, you're not the only one. It's more common than most men think, especially after 50. Third, loss of morning erections. If you used to wake up with regular spontaneous erections and now they're gone, that's not just about aging. That's often a sign of vascular problems, low testosterone, or hormonal imbalance. And those things don't just affect your sex life. They affect your heart, energy, mood, and long-term health. So here's the key takeaway. This conversation isn't just about size. It's about your health, your system, your quality of life. And here's the silver lining. Almost all of these issues are treatable, but only if you stop avoiding them and start asking the right questions. Start with one, is what I'm experiencing normal, or is it a sign to take action? If you're not sure, don't Google it. Talk to a doctor. That's what we're here for. Alright, let's tackle the question that's probably been sitting in the back of your mind this whole time. Can you actually increase your size or restore what you think you've lost? Let me be totally honest with you, because you deserve straight talk, not snake oil. There's no magic pill, no guaranteed overnight miracle. But, and this is important, that doesn't mean nothing helps. Let's talk about what actually works. First, weight loss. It sounds basic, but it's one of the most effective and underrated strategies. When you lose weight, especially belly fat, the pubic fat pad shrinks. That's the soft tissue that can cover the base of the penis. Lose that pad, and suddenly 1 to 2 centimeters of length becomes visible again. You're not growing, you're revealing what was hidden. No gimmicks, just anatomy working in your favor. Second, testosterone therapy. But here's the key, only if your levels are clinically low. Bringing testosterone back to normal doesn't just help libido, it can improve erection quality, firmness, and that feeling of fullness. In most cases, that's what men are truly after, not more centimeters, but better performance and confidence. Third, mechanical aids. Vacuum pumps, traction devices, extenders. Some guys do see modest results, but it takes time, patience, and consistency. The effects are usually temporary or subtle, and you need to know what you're doing. They're tools, not miracles. And yes, surgery exists. But it's not first line. It's invasive, expensive, and often not worth the trade-offs. It's reserved for very specific cases, like severe deformity or trauma. If someone promises a quick fix with surgery and no risks, walk away. That's not medicine, that's marketing. So, what's the bottom line? Don't chase centimeters. Chase function, blood flow, hormonal balance, and confidence. Because confidence isn't built by adding 2 centimeters. It's built when your body feels strong, your erections are solid, and your mind knows, I'm healthy, I'm capable, I'm back in control. Think of your penis like a sponge. It needs regular blood flow, healthy hormones, and yes, regular use. That's how you keep it alive, responsive, and fully yours. Look, size anxiety is real, and I get it. You see a change, you compare yourself, you start to doubt, and suddenly that doubt takes over your confidence. But here's what most men don't realize. They're worrying way more than they need to. Your value doesn't come down to a number. What matters is your strength, your vitality, your connection with your partner, your body, and your life. And the good news? You can get that back. No matter where you are in your health journey, there's always a step forward. Maybe it's checking your testosterone. Maybe it's changing your diet. Maybe it's just talking to someone and getting real answers instead of scrolling through myths. So here's what I want you to do. If you found this video helpful, hit like. It helps more men find this info. If you've got questions, drop them in the comments. I read them and I'll answer what I can. Let's have a real, honest, man-to-man conversation. You don't need to figure this out alone. Your health matters. Your confidence matters. And yeah, your peace of mind matters too. Thanks for watching. Stay strong, and I'll see you in the next video.